Extensor retinaculum. The deep fascia on the back of the wrist is thickened to form the extensor retinaculum. This is the deep fascia of the back of the wrist, which is thickened. This become thickened and form the extensor retinaculum. It is a oblique band. This is a oblique band, not a straight line, and directed downwardly and medially. This is the little finger, so it is directed downwardly and medially. Here this is also the little finger. This is directed downwardly and medially. Attachment laterally to the anterior border of the radius. This is the lateral side because this is the great finger or thumb, so it is attached to the anterior border of the radius and medially to the tricolateral and fusiform bone. Compartment. There are 6 osteophyseal compartments formed on the back of the wrist. This is the back side of the wrist. Here is the 6 compartment: first compartment, second, third, fourth, fifth and sixth. Each compartment is lined by a synovial sheath, which is reflected onto continued tendon. This is the flexor retinaculum. There are 6 compartments. Each compartment is lined with a synovial membrane. This synovial sheath we can see in the continued tendon. The structure in each compartment. In first compartment, there are 2 things: extensor pollicis brevis and abductor pollicis longus. This is the first compartment in the inside of the thumb, where one is for extensor pollicis brevis and another is for adductor pollicis longus. In second compartment, the extensor carpi radialis longus. This is the second compartment. There is 2 components. One is extensor carpi radialis longus and another is for extensor carpi radialis brevis, and another is for extensor carpi radialis brevis. In the third compartment, the extensor pollicis longus. The component of the third compartment is extensor. This is the third compartment, extensor pollicis brevis. And in the fourth compartment, the extensor digitorum. This is the fourth compartment. The component is extensor digitorum. So these are the extensor digitorum and extensor indices. These are extensor indices to the index finger. And posterior interosseous nerve. There is one nerve which is called posterior interosseous nerve, and anterior interosseous nerve. Anterior and posterior both the nerve passes through the fourth compartment. In the fifth compartment, extensor digiti minimi. This is the fifth compartment and it is passing the extensor digiti minimi. And next, in the sixth compartment, the extensor calvi ulnaris. This is the sixth compartment, and the element component passed through this are extensor calvi ulnaris.